Female hair thinning, hormonal causes and evidence-based treatments. If you're a woman noticing that your hair feels thinner than it used to, maybe your part looks wider or your ponytail doesn't have the same volume, you're not imagining it. What often surprises women is that hair thinning can occur even when hormone blood tests come back within the normal range. In many cases, the issue isn't hormone levels themselves, but how sensitive the hair follicles are to hormonal signals over time. This distinction is critical when it comes to understanding and treating hair thinning realistically. The most common cause of gradual thinning in women is female pattern hair loss, also called female androgenetic alopecia. Unlike male pattern hair loss, this condition usually affects the central scalp and part line while keeping the frontal hairline mostly intact. At the follicle level, hair does not suddenly stop growing. Instead, follicles undergo a process known as miniaturization. Each growth cycle produces hair that is slightly thinner, shorter, and weaker than the last. Over time, overall hair density decreases, even though the follicles themselves remain alive. Although testosterone is often thought of as a male hormone, women naturally produce small amounts of it. Some women have hair follicles that are genetically sensitive to dihydrotestosterone, or DHT, which is derived from testosterone. DHT shortens the hair growth phase and gradually causes follicles to shrink. This process can occur even when testosterone levels are normal. Hormonal shifts such as polycystic ovary syndrome, stopping hormonal birth control, or age-related changes can make this follicle sensitivity more noticeable. Estrogen plays a protective role in hair growth by helping keep hair in the active growth phase for longer periods. When estrogen levels decline, hair spends less time growing and sheds more easily. This is why increased shedding is commonly seen after childbirth, during perimenopause, and following menopause. Thyroid hormones are another critical factor. Both underactive and overactive thyroid conditions are strongly associated with diffuse hair thinning across the scalp. In many cases, hair density improves once thyroid hormone levels are properly managed. Chronic stress is an often overlooked contributor. Prolonged elevation of stress hormones can push large numbers of hair follicles into the resting phase, leading to a condition called telogen effluvium. Hair shedding from stress typically appears 2 to 3 months after the triggering event. Because female hair thinning is often multifactorial, identifying the cause involves looking at patterns rather than relying on a single test. Common signs that hormones may be involved include thinning at the crown, a widening part, increased shedding after illness or pregnancy, and changes that occur alongside menstrual or menopausal symptoms. Blood tests that are commonly useful include a full thyroid panel, ferritin to assess iron stores, and vitamin D levels. Hormone testing may be appropriate in some cases, but normal results do not rule out hormone-related hair thinning. When it comes to treatment, topical minoxidil is the most evidence-based option for female pattern hair loss and is FDA approved for women. It works by prolonging the growth phase of the hair cycle and increasing follicle activity. Clinical studies show that consistent use can improve hair density and slow further thinning. Temporary shedding during the first few months of minoxidil use is common and usually indicates that follicles are transitioning into a new growth cycle. Addressing contributing factors is just as important. Low iron stores, thyroid disorders, chronic stress, and scalp inflammation can all worsen hair thinning. Correcting these issues supports healthier long-term outcomes. It's important to be cautious with products that promise rapid regrowth. Most oils, supplements, and so-called miracle treatments do not alter follicle sensitivity or hormone signaling. Meaningful improvement takes time, often 6 to 12 months, and consistency matters far more than intensity. Female hair thinning can be distressing, but in many cases it is manageable with an evidence-based approach. Hormones don't have to be severely imbalanced for hair to thin. Genetics, follicle sensitivity, and life stage changes are often the true drivers. If you found this Dr. Follicle video helpful, consider subscribing today for more science-based hair and scalp education.